investing in the infrastructure as well as in the health system, so that the continent, the population within the continent will have a good health security. With that mandate, Africa CDC based its headquarters.
Ourselves. So, as I said, my job will be to have a look at the different pieces of evidence and to give my honest.
Introduction to policy briefs. I'll give you key points to note when you write policy briefs. Those who submitted their policy briefs, I extracted, you will see in a while I'll extract issues that we have with them and how to avoid those pitfalls. I will talk a lot about it. Then I'll give you a brief overview of structure of a typical policy brief. I don't particularly like the idea of
there for me, gender mainstreaming, and I kind of ran away from it and came down to gender and intersectionality research. Gender mainstreaming is heavy, and I don't want us to get there, so that we can focus on how to incorporate gender and intersectionality analysis into our research. And thank you. All that you have said are key concepts.
Thank you, African Health Economics and Policy Association, for organizing this workshop. Thank you all for your participation and dedication to this important cause. I look forward to a productive and inspiring workshop. Thank you.
Like leaders. So the women have their own meeting, the men have their own meeting. In those meetings, they always tend to elect people that are educated. So if I'm attending the meeting, they want the doctor to be the leader. And not because I participate more, not because I even have more knowledge about what's going on in the community, not because I can contribute more to the discussion and be more strategic as a leader. But just because I'm maybe the most educated in the group and they elect you. So it's not just gender, it's every other social identity, and that is why it's important that we are looking at all of this. We are looking at gender and the interactions with all of that.
When we have a scientific strong methods, any report can be reviewed and can be like a trustworthy worthy report to be read by all people. So one of the things that I may share with you, considering GBI, when we talk about GBI, so we have the PCC, population, context, and concept. So if we have PCC, a correct PCC, then we can continue. Also, we can refer to ArcSI. I don't know if you have the same reference, but ArcSI also discuss about scoping review and the difference between scoping review and literature, systematic review. But yeah, if we have a good PCC, then we have a good platform to have all our papers there, like Ryan or something. Ryan, it's for free. That's why I'm considering Ryan, because it's free, and it's very, very important to have many collaborators who can also take decision when choosing your article based on the inclusion.
I wrote rigorously documented every step in red, just to make sure that I don't miss it in my notes. Because we, as I said, this is like peer learning, and I want us to look at it that way. We all run, we got fall in this temptation of sort of knowing something, but some sort of feel that the reviewer knows what we know. Sometimes the reviewer just, is basically like, pretends to be as unknowledgeable as possible and wants you to really make everything clear. So why I'm saying this is that we have done some nice work. We have done literature searches. We've gotten some results, right? But I think what I discovered is that some people neglected some steps. That nice diagram that you just flowchart that you drew. Some people neglected some steps. So if we look at the the AfHEA and O'Malley framework that we were asked to use, there's a statement here under the extraction that they said the process of a scoping review should be documented in sufficient detail to enable the study to be replicated. And replication is very important because when we submit this to the
vulnerable groups, and then the fact that we mentioned prisoners here. I don't know in the context of COVID, whether prisoners can be classified as a vulnerable group, because I'm just thinking in our context here in Ghana, we thought that those who could move around were more exposed to getting COVID than, so people were even asked to stay at home. So if prisoners are already in a confined, area, do we think that they are vulnerable in this context?
Prison guards are not confined. They go home and come back. New prisoners come every day from outside. So that would, actually prisoners were very high risk because these congregate populations. If just one person gets in there,
Make this workshop a success. Thank you very much for your efforts. And second, thank you, a big thank you for all the consultants here. So you are making a big, let's say, difference in the research in the African region, I think.
I want to thank individual researchers, resource people who are quality assurance, gender experts, and importantly, our co-partners, Africa CDC to my left and UNECA to my right, for our continuous collaboration that has led us this far, and we are kind of assured that we will